What if surgeons could do more than just stitch up wounds? What if they could actually start regenerating healthy tissue right there inside the body? Well, today on The Explainer, we're looking at a tiny printer that represents a truly giant leap in how we think about healing.
So let's start with this idea, because it's a simple one, but it's incredibly powerful. Just imagine a future where healing isn't just about patching things up, it's about rebuilding them from the ground up, literally, cell by cell.
And our story really kicks off with one of the most delicate and, important tissues in our entire body, our vocal cords. They're absolutely essential for everything from speaking to breathing, but wow, are they fragile and notoriously difficult to repair when something goes wrong.
Yeah, so when these tissues get damaged, the way we fix them now, it's a real challenge. It all relies on sutures, stitches. But the big problem is that they can easily cause scar tissue to form. And that scarring, it often messes with vocal function permanently, which, as you can imagine, can totally upend a person's quality of life. It's a fix, sure, but it's often far from a perfect one.
But now, this is where it gets interesting. Researchers have developed a game-changing tool that honestly looks like something straight out of a sci-fi movie. It's a completely new approach that moves beyond just simple repair and gets us into the realm of true regeneration.
So what is it? It's a tiny bioprinter. It's so small that a surgeon can use it right there in the operating room. So instead of just stitching a wound closed, the surgeon can literally print new, living tissue directly where it's needed, right in the middle of the surgery.
The technical name for this is in-situ bioprinting. In-situ is just a fancy way of saying in the original place. And this is a huge leap forward because it takes all this incredible technology out of the lab and puts it directly at the point of care, right inside the body where it really matters.
Okay, so how does this little wonder actually work? I mean, what does it really mean to print living cells? Well, it turns out to be a really precise and kind of elegant process.
It all breaks down into a beautifully simple three-step process. First, the surgeon just positions the device right at the surgical site. Second, a special bioink, which is loaded up with the patient's own living cells, is delivered through the printer. And finally, the device prints that ink, layer by layer, precisely mimicking the structure of the original healthy tissue.
When you see it side by side like this, you really get it. It highlights a fundamental difference in the whole approach. The old way is about mending with stitches, and that often leads to scarring. This new method is all about regeneration, using a precision printer and a bioink to actually rebuild tissue. The goal is a much better outcome with far less risk.
But here's the thing, the potential of this technology goes way beyond the voice. Fixing vocal cords is just the beginning. You can think of it as the proof of concept for much bigger revolution in medicine.
Researchers are really confident that the same in-situ bioprinting approach could one day be adapted for all sorts of other complex soft tissues. I mean, just imagine repairing torn cartilage in a knee, or damaged muscle after an accident, or maybe even delicate nerve tissue. The ability to just print customized, patient-specific tissue on demand, well, it could completely revolutionize treatment for countless people. This offers real, tangible hope for conditions and injuries that today have very limited or, frankly, pretty imperfect treatment options.
So what this really marks is a shift in our entire philosophy of surgical repair. We're moving away from a mechanical model, just fixing the body like a machine, and we're moving toward a biological one, actively helping the body rebuild itself.
This quote just nails it, doesn't it? It perfectly captures the essence of this innovation. It's taking all that sophisticated, complex science from the bioprinting lab and putting a practical, powerful tool directly into a surgeon's hands, right when and where they need it most.
And this one brilliantly illustrates the ultimate vision. It's not just about repairing an injury, it's about restoring function, about restoring health in the most natural way possible, by creating new, living tissue right where it belongs.
This technology really points to a future where regeneration isn't some miracle, but just a standard medical procedure. And it leaves us with a really critical question. How many of the injuries that we consider untreatable today could one day be completely reversed? It really makes you think.